Dr. Lee, I want you to explain to me the brushing of teeth, the dental hygiene. And while we all have learned it in school, the truth is there's still lots of slightly different opinions. I want to get your take, your opinion. Hard brush, soft brush, up and down, sideways, circular, 45-degree angle to brush towards your teeth, 90-degree. I mean, all these datas are out there, these datums are out there. Why don't you tell us a little bit what you think we should pay attention to?
Okay. Well, basically, what you want to understand is the plaque, that sticky stuff that has all the bacteria. It's going to form around the gum line. So where the gum meets the tooth, that's where your primary focus should be when you brush. When you brush, you should angle the brush, like you said, at a 45-degree angle towards the gum line, and small circles, and where you allow the bristles to go underneath the gum slightly. That creates a massaging effect and creates blood flow around there, so your body can help fight bacteria, and also allows the brush to go underneath the gum slightly and clean right around the gum line. I think a lot of people, when they brush, they just kind of brush like this, and they might clean the majority of the surface of the teeth, but they don't clean right along the gum line where you'll tend to get the cavities and the gum problems. So a lot of people do brush and floss, but they're not doing it in a proper fashion. So they're very surprised when they find out they have cavities or periodontal disease.
Got it. Now, so should we use soft or hard brushes? Should we use electric brushes or hand brushes? Is there any difference at all? Or is it just a personal liking?
Well, you should definitely stay with the soft toothbrush. You don't want to ever use a medium or hard toothbrush. The bristles themselves are coarse enough, and the toothpaste has like a pumice inside there, so it's an abrasive compound that's going to help clean your teeth. So you don't really want to use anything too hard because it will damage your gums, and you can end up having more gum problems and gum recession because of that. Between a manual and electric toothbrush, either one, it really is fine. You just want to use the right technique. That one's just really a personal preference. Some people, if they find they might not have the manual dexterity to use a manual toothbrush, they might use an electric toothbrush. It vibrates a lot more, so per pass, it allows you to clean a lot better. So, but there are plenty of people who do very well with a manual toothbrush. So, I think that's a decision you can make with your dentist if you want. He can see how you're doing with your manual brush or your electric brush, and you guys can find something that's good for you.
Okay. Any preferences we should pay attention to in terms of toothpastes?
Toothpaste, I like this one. As long as it has fluoride in it and you like the taste of it. If the toothpaste, it burns your mouth a lot and you don't like to use it, you're not going to brush for very long. The most important thing about brushing really is that you actually do brush for about 2 to 3 minutes each time. If you don't like the taste of your toothpaste, you won't brush with it, right? So, that's really the key. Most toothpaste out there have fluoride in it, and aside from that, personal preference is just on taste.
Got it. Now, Dr. Lee, about 15 years ago now, I lived for a couple of years in India, in Bombay, and everybody there, pretty much everybody, was using a tongue scraper. So I started using one too, never did before. I've in the meantime kind of stopped using a tongue scraper and use my toothbrush all the time. Frankly, I kind of gag a little bit on it every day, but you get used to it and you do it. And I brush my gums and the palate, and I brush the tongue. So anyway, what do you have to say on that? Is it something we should do, and if we do it, is one or the other one, the brush or the scraper, better?
I think there have been some studies out, trying to compare how a tongue scraper works versus a toothbrush. Some people have said that a toothbrush, you really just kind of mash things around in there. The tongue scraper, you kind of help clean and pull things off. So it's one of those things where you can do a fine job with a toothbrush to clean everything off. Some people, it's really a personal preference in my opinion. A tongue scraper, I use one on occasion also, but I don't feel that it's always necessary. So it really is just personal preference on hygiene. If you feel like it cleans you better, then by all means use one. If you find there's not much of a difference, then, you're okay probably not using one. In terms of brushing the gums, the palate and everything, those tissues are really self-cleansing, and they don't really need to be brushed. So, if you're brushing your gums too hard, sometimes you can cause recession. So, I don't necessarily recommend it because your gums and cheek, palate, and everything are self-cleansing. So you can probably leave that part alone.
But what about the tongue? The tongue, you should use one or the other one, a brush or the scraper.
Yeah, the tongue I would definitely use a brush first and then use a tongue scraper afterwards if you're going to use it. I wouldn't use a tongue scraper primarily just because, sometimes it doesn't remove all the plaque that's stuck in and around the tongue. You still do need to brush it.
Mm-hmm. Good. Well, all right. Dr. Lee, thank you very much.
Thank you.